Dry eye disease is a serious disease. It affects many people and it needs serious attention. The whole purpose of this meeting is just that. Eye health starts at the surface, but I want to add to that. It also finishes at the surface. How big is this problem? It's a growing problem because the population is growing older, so it gets worse as one ages. But then we live in the age of technology. Even our kids are in front of screens for multiple hours a day. I have 10-year-olds in my practice who are suffering from dry eyes. And that is if they're lucky enough for the parents to recognize it and bring them to us. It's a disease that is affected by other disease processes, the autoimmune diseases, rosacea, hormonal changes, but it happens in both genders. It needs serious attention because hormones do affect dry eyes. We need to be holistic doctors to treat any disease entity, especially dry eyes. The prevalence in the world is over 745 million. In this country, about 85 million. 86% of the population that suffers from dry eyes suffers from evaporative dry eye disease when they're lacking the oil layer on the surface of their eyes. About 1 out of each 2 patients who walk into our offices have been estimated to suffer from dry eyes. I think that's an underestimation. They say about 60% of our surgical patients suffer from dry eyes. The reason I think the reports are underestimations of the disease is because it's a silent disease. The reports, depending on which literature you look at, vary. They're all high, but they vary. But the one thing they all agree on is that this disease has become the most prevalent disease in the field of eye care, and the fact that it affects all ages, all occupations, and all genders. The true statistics, in my opinion, are much higher, and the reason being this. Most of these estimates come from symptomatic patients and patients who are being diagnosed in doctors' offices. Most of the patients who suffer from dry eyes, as some of our patients will attest, they don't even know they have dry eyes when they're kids, when they're teenagers. So this estimation is a gross underestimation of the number of people suffering from this disease. The spectrum of this disease is a wide one. In this mild form is merely a nuisance in your daily activities, but that's only when it's in this mild form. As it progresses, it becomes debilitating. It handicaps people. When it goes undiagnosed and untreated, it affects them for the rest of their lives. In its advanced form, it's an actual crisis. And unfortunately, many of these people who have that advanced form, they're young people. They're young mothers. They're technology workers. It affects them in every aspect of their livelihood. They cannot perform their work. They cannot be normal in their social activities. It gets so advanced that even when they come and find those of us who care for the disease, we come short in giving them relief. My first call to action: we need public and professional awareness of this disease. I want to beg my esteemed primary care physician colleagues, some of whom are in this room today, please include questions about dry eyes in your inquiry from your patients. It is as important as their blood pressure. To my derm colleagues, the next time you see a teenager who's suffering from acne, think twice before you put them on a medication that causes such severe dryness that they suffer for the rest of their life. The list goes on. We have colleagues in other fields that need to pay attention to what happens to patients when they put them on different medications. However, my main point here is that we are better together. Doesn't matter what field we specialize in. I need to learn from my primary care physician colleagues. I need to learn from my derm colleagues. Let's sit down, let's have multidisciplinary meetings, and let's become the doctors we were meant to be. I need to know about your fields. Please afford us the opportunity to tell you about ours. The patients are the same patients. Let's join forces. And my main message today is to our esteemed Academy of Ophthalmology board members. Let's review some facts. This is statistically the most prevalent eye disease in the world now. All our colleagues in other subspecialties, cornea, retina, glaucoma, oculoplastics, neuro-ophthalmology, pediatric ophthalmology, all of their good work doesn't realize the potential they're working so hard for if the ocular surface is not healthy. This is a disease they all need to be concerned about. Ocular surface is the first and the last thing in eye care. Without a clear window, you cannot see the beautiful view, no matter how well you work in other structures in the eyes or elsewhere. So my request to the board is simply this. Isn't it time for this field to become its own subspecialty? A field that has more patients than any other subspecialty. And there is no other subspecialty that is exempt to the health of the ocular surface for the work that they perform. My interest in this field got started way before any of the technologies in this room existed. It was 25 years ago, and I was a resident. And I was humbled when my wonderful mentors said to me, oh, it's in your blood. You can do this surgery in your sleep. And I was humbled by that. They said, oh, we're going to graduate someone in you that we'll go to ourselves. I was humbled by that. But I would go to the office or to the clinic the next day. I would see my patients where I had done a smooth surgery, and they didn't have exactly 20/20 consistent vision. The vision would fluctuate no matter how smooth the surgery had gone. That's when I started talking to my wonderful mentors and said, what's going on? And I started being involved in research in the ocular surface because I realized early on, doesn't matter how good of a surgeon you are. If the ocular surface is not healthy, your work is not going to produce the results that it deserves. The AAO has always taken the lead to organize our subspecialties. They've done a wonderful job. I am thankful to them. I am who I am because of them. I'm humbly begging them today. Please help us bring more public awareness to this disease. A disease that's chronic and silent, and if untreated and undiagnosed, becomes debilitating to patients. I also want to beg the Academy to let doctors teach doctors. Since when have we had industry teach us? In the field of dry eyes, is the only field when there's a new technology, the poor rep has to come to the office and present the technology to us and beg for a couple minutes of our time to listen to them to see what the technology is doing. They're behind the 8 ball with us because the disease is not important enough for us. And they're behind the 8 ball because doctors don't learn from industry folks. Doctors learn from doctors. I didn't become a cataract surgeon by learning cataract from the company that produced the phaco machine. I learned it from other doctors, and then I chose my phaco machine. The knowledge, the know-how, the passion for a disease has to be transferred from doctor to doctor, not from industry to doctors. This field needs to be its own subspecialty. Doctors need to teach doctors, and the industry can come to our aid by providing the technology we need and the tools we need to treat our patients. I hope our message gets heard. This meeting was put together to deliver this message mainly. I want to end my talk here by saying we need more eye care professionals to join us in an effort to bring the serious attention to a serious disease that is causing major distress in patients who deserve better care. This meeting was a small effort on my part to deliver that message today. And I'm so humbled with your gracious presence here to help me deliver that message. Thank you. Eye health starts at the surface, but I want to add to that, it also finishes at the surface.